Welcome to Comfort Bridge Healthcare. Today, we're diving into the foundation of your career as a certified nursing assistant, understanding your role, responsibilities, and ethical duties. Let's get started. 1. Responsibilities and scope of practice. As a CNA, you are the backbone of patient care. Your primary responsibilities include assisting with daily living activities such as bathing, dressing, feeding, and mobility. You will take vital signs, observe and report changes in patient conditions, and ensure a safe and clean environment. However, it's crucial to remember your scope of practice. CNAs do not administer medications, perform invasive procedures, or diagnose medical conditions. Your role is supportive, always under the supervision of a nurse or healthcare provider. 2. Role of the CNA in the healthcare team. CNAs are essential members of the healthcare team, working closely with nurses, doctors, therapists, and other medical professionals. You serve as the eyes and ears of the team, noticing subtle changes in a patient's condition that others may not see. Teamwork is key. Always communicate effectively, follow instructions, and document patient information accurately. Your role ensures that the healthcare team can make informed decisions for the best patient outcomes. 3. Legal and ethical considerations. As a CNA, you must adhere to legal and ethical standards. Key legal aspects include maintaining patient confidentiality under HIPAA, Health Insurance Portability and Accountability Act, following facility policies, and practicing within state regulations. Ethically, you are expected to provide compassionate, respectful, and non-judgmental care. Always be professional, report any suspicions of abuse, and never engage in neglect or misconduct. 4. Residents' rights and patient advocacy. Patients and residents have rights that must be upheld at all times. These include the right to dignity, privacy, informed consent, and freedom from abuse and neglect. As a patient advocate, you are their voice when they cannot speak for themselves. If you see something wrong, report it. If a resident has concerns, listen. Your advocacy ensures they receive the quality care they deserve. In conclusion, your role as a CNA is vital to patient care. By understanding your responsibilities, working as a team player, adhering to ethical standards, and advocating for your residents, you will make a meaningful impact every day. Next is a comprehensive description of how your role impacts the health of patients and how your collaboration with other healthcare providers helps in the delivery of good and quality care.
Imagine a hospital. What comes to mind? Perhaps a bustling emergency room, surgeons in green scrubs, or complex machines beeping in unison. At the very heart of patient care reside the certified nursing assistants, or CNAs. Often unseen, always essential, these individuals are the bedrock of the healthcare system. This essay will delve into the multifaceted role of a CNA, exploring their responsibilities, their vital place within the healthcare team, and the ethical framework that guides their every action. The tasks of a CNA are as varied as the patients they serve. From assisting with bathing and dressing to monitoring vital signs, each day presents a new set of challenges and triumphs. While their days are filled with practical tasks, the role of a CNA extends far beyond the physical. They are often the first to notice subtle changes in a patient's condition, acting as crucial conduits of information to nurses and doctors. What truly distinguishes CNAs is their unwavering commitment to patient well-being. They provide not only physical care but also emotional support, offering a listening ear and a compassionate presence. In an environment that can often feel sterile and impersonal, CNAs bring warmth, empathy, and genuine human connection. CNAs are often a source of comfort and information for families navigating the complexities of illness and recovery. The heart of a CNA's work lies in providing direct patient care, ensuring comfort and dignity in the most fundamental aspects of life. Beyond personal care, CNAs are instrumental in maintaining a patient's physical well-being. This includes taking and recording vital signs, serving meals, and assisting patients with mobility. The work of a CNA also extends to maintaining a clean and safe environment for patients. By creating a comfortable and hygienic space, CNAs contribute to a sense of security and well-being for those in their care. Finally, CNAs play a vital role in communication within the healthcare team, observing and reporting any changes in a patient's condition. While the core duties of a CNA revolve around basic care and observation, their skills and responsibilities often extend beyond these fundamental tasks. Depending on their work setting and experience, CNAs may receive specialized training to perform additional procedures, always under the supervision of a licensed nurse. CNAs working in a hospital setting might assist with more complex procedures, such as taking electrocardiograms or changing simple dressings. In long-term care facilities, they may be trained to provide specialized care for residents with dementia or Alzheimer's disease. The ability to adapt to different patient needs and work environments is a hallmark of a skilled CNA. While CNAs are entrusted with a wide range of responsibilities, it is crucial to understand the boundaries of their professional activities. Each state has clearly defined guidelines outlining the scope of practice for CNAs, ensuring that they operate within their training and expertise. CNAs are not licensed to perform tasks that require the knowledge and judgment of a registered nurse or other licensed healthcare professional. Understanding these limitations is paramount in ensuring patient safety and upholding professional standards. In the intricate machinery of healthcare, certified nursing assistants are not merely individual caregivers, but vital cogs that keep the entire system running smoothly. They are integral members of a larger team, working in close coordination with nurses, doctors, therapists, and other healthcare professionals. This collaborative approach ensures that patients receive comprehensive and well-coordinated care. CNAs, nurses, doctors, and other healthcare providers each bring their specialized knowledge to the care of the patient. The CNA, though perhaps not the most prominent instrument in the orchestra, plays a vital role in maintaining the rhythm and flow of care. Their positive attitude and dedication to patient care are contagious, fostering a sense of camaraderie and shared purpose within the team. Effective communication is the lifeblood of any successful team, and this is especially true in the fast-paced and often high-stakes world of healthcare. CNAs serve as crucial communication links between patients, nurses, and other members of the healthcare team. Their ability to communicate clearly, accurately, and with empathy is essential in ensuring that patient needs are met and that care plans are implemented effectively. Furthermore, CNAs are often the first point of contact for family members who have questions or concerns about their loved one's care. Their ability to listen attentively, provide reassurance, and communicate complex medical information in a clear and understandable manner helps to alleviate anxiety and foster trust. While CNAs may not have the medical expertise of doctors or nurses, their proximity to patients grants them a unique perspective that is invaluable in providing optimal care. They spend countless hours with patients, assisting with intimate tasks, observing their behaviors, and listening to their concerns. This intimate knowledge makes CNAs powerful advocates for their patients, ensuring that their voices are heard and their needs are met. This ability to recognize subtle changes in a patient's condition and communicate them effectively to the healthcare team can be crucial in preventing complications and promoting timely interventions. Their advocacy extends beyond the physical realm, encompassing the emotional and psychological needs of those in their care. The work of a certified nursing assistant, while deeply rewarding, comes with significant responsibility. CNAs are entrusted with the care of vulnerable individuals, and their actions are governed by a complex web of laws and regulations designed to protect both patients and healthcare providers. Understanding and adhering to these legal frameworks is not merely an option, but a fundamental requirement for every practicing CNA. One of the most critical aspects of legal compliance for CNAs is understanding their scope of practice. Operating outside of these boundaries, even with good intentions, can have serious legal ramifications, potentially jeopardizing patient safety and the CNA's own career. Furthermore, CNAs must be aware of laws and regulations related to patient privacy and confidentiality, such as the Health Insurance Portability and Accountability Act, or HIPAA. Ethics in action guiding principles for CNAs. Beyond the letter of the law, the work of a CNA is guided by a profound ethical framework. These ethical principles, often instilled during training and reinforced through experience, serve as a moral compass, guiding CNAs in their interactions with patients, families, and colleagues. One of the most fundamental ethical principles for CNAs is respect for patient autonomy. Beneficence, the principle of acting in the best interests of the patient, is another cornerstone of ethical care. Justice, the principle of fairness and equity, is also paramount in a CNA's work. Maintaining confidentiality, HIPAA, and patient privacy. In the digital age, where information flows freely, protecting patient privacy has become more critical than ever. CNAs play a vital role in safeguarding sensitive patient information, both in their daily interactions and in their handling of medical records. Understanding and adhering to privacy regulations such as the Health Insurance Portability and Accountability Act, or HIPAA, is not merely a legal obligation, but an ethical imperative. CNAs must be vigilant in protecting PHI in all forms, whether it's a paper chart, a computer screen, or even a casual conversation. Recognizing and reporting abuse, a CNA's duty. As frontline caregivers, CNAs are uniquely positioned to identify and report signs of abuse, neglect, or exploitation. Their close proximity to patients, particularly those who are vulnerable due to age, illness, or disability, makes them essential advocates for patient safety and well-being. Recognizing and reporting suspected abuse is not merely an option, but an ethical and legal obligation. Imagine yourself in a hospital bed or a nursing home, your independence stripped away by illness or age. Certified nursing assistants play a crucial role in upholding residents' rights, ensuring respect, compassion, and dignity. Residents are granted specific rights under federal law, including quality care, privacy, and participation in their own care. CNAs are vigilant in protecting these rights, ensuring residents' voices are heard and respected. Imagine a patient struggling to communicate their needs due to illness or cognitive impairment. CNAs serve as a vital voice for the voiceless, ensuring every patient's needs are met. Effective advocacy requires keen observation, active listening, and understanding of individual needs. CNAs are trained to recognize subtle changes in a patient's condition and communicate these to the healthcare team. They provide emotional support, ensuring patients' voices are heard and their rights protected. In healthcare, emotions run high and communication breakdowns can have significant consequences. CNAs often mediate between patients, families, and healthcare providers. Their ability to communicate effectively and resolve conflicts is essential. CNAs act as a calming presence, listening and providing clear information. Effective communication is key to successful conflict resolution. Empowering residents, promoting independence and choice. CNAs empower residents to maintain independence and autonomy. Small acts of self-determination impact dignity and well-being. CNAs encourage residents to participate in their own care. This includes choosing clothing, assisting with bathing, or feeding. CNAs celebrate small victories and focus on abilities. Empowerment extends to decision-making and care preferences. CNAs ensure residents' preferences are heard and respected. This respect is fundamental to their dignity. The unsung heroes of healthcare. Certified nursing assistants, often working behind the scenes and away from the limelight, are the unsung heroes of the healthcare system. They are the compassionate caregivers, the keen observers, and the unwavering advocates for those entrusted to their care. Their work, though often physically and emotionally demanding, is deeply rewarding, offering a profound sense of purpose and the satisfaction of making a tangible difference in the lives of others. Throughout this essay, we have explored the multifaceted role of CNAs, delving into their responsibilities, their vital place within the healthcare team, and the ethical framework that guides their every action. We have seen how their dedication to patient well-being extends beyond the physical tasks of caregiving to encompass emotional support, advocacy, and the preservation of dignity for those facing illness, injury, or the challenges of aging. CNAs are the heart and soul of healthcare, providing a human touch in an environment that can often feel sterile and impersonal. They form deep connections with their patients, offering companionship, a listening ear, and a reassuring presence during some of life's most vulnerable moments. Their empathy and compassion shine through in every interaction, reminding us that true caregiving extends far beyond medical charts and treatment plans. As the demand for healthcare services continues to rise, the role of CNAs is becoming increasingly vital. The aging population, coupled with the growing prevalence of chronic illnesses, has created an unprecedented need for skilled and compassionate caregivers, particularly in long-term care settings. CNAs are uniquely positioned to meet this growing demand, providing essential care and support to those who need it most. However, the critical role of CNAs often goes unrecognized and underappreciated. The physical and emotional demands of the job, coupled with often low wages and limited career advancement opportunities, have contributed to high turnover rates and a shortage of qualified CNAs in many areas. Addressing these challenges is crucial to ensuring the future of high-quality healthcare. Investing in CNA education and training, improving working conditions, and offering competitive wages and benefits are essential steps in attracting and retaining skilled and dedicated individuals to this vital profession. Moreover, raising public awareness about the essential role of CNAs is paramount. Recognizing their contributions, not just during National Nurses Week but throughout the year, is essential in fostering a greater appreciation for their dedication and the invaluable services they provide. For those seeking a career that is both challenging and deeply rewarding, the path of a certified nursing assistant offers a unique opportunity to make a tangible difference in the lives of others. It is a career that demands compassion, empathy, and a genuine desire to serve those in need. The work of a CNA is not for the faint of heart. It requires physical stamina, emotional resilience, and the ability to handle difficult situations with grace and professionalism. However, the rewards far outweigh the challenges. The smiles of gratitude from patients, the heartfelt thank yous from family members, and the deep satisfaction of knowing that you have made a positive impact on someone's life are just a few of the intangible rewards that come with this calling. Embracing the CNA path is not merely a job choice but a commitment to service, compassion, and the fundamental dignity of every human being. It is a career that offers the opportunity to make a real difference in the world, one act of kindness, one comforting touch, one unwavering advocacy at a time.
Great job on completing this module. Now let's continue building your skills by moving on to the next lesson, communication and interpersonal skills. Effective communication is the foundation of excellent patient care, helping you connect with residents, families, and healthcare professionals. Click on the next module to learn how to communicate with confidence, empathy, and professionalism. See you there. Ta.